been working at the VA. It'll be 7 years in June. Longest I've ever worked in one location. My husband is retired Air Force, so I held a job for every 2 years, and then we moved and I'd look for one. So pretty excited. I'm not quite sure what to do with myself. Again, my husband's Air Force, retired Air Force. He was a communications officer. He's now a contractor at Buckley, working for top secret golf ball location. Yeah, we can't talk about.
I built them.
You built them? They're pretty cool.
Pretty cool. What's inside?
I've seen a conference room. That's all I've seen in that building. So anyway, we've traveled the world. I've worked for several Air Force major commands as a protocol specialist. So I've always been the party planner person that's always at the general's house, making sure that everyone has enough wine and whiskey and whatnot that's imperative to good communications. So again, thank you for having me. And so I work in public affairs. I'm the community outreach specialist. So I go out, I talk to communities, I talk to organizations. I'm also involved with I go to the DAV, the VFWs, wherever that somebody needs information. I will also be at resource fairs. So as I mentioned earlier, if you guys have flyers regarding your museum, I'd be happy to take them with me to wherever I am at and get them out on my table and help promote the museum here. This is pretty awesome deal what you guys have going on. So when you hear the VA, a lot of people are confused. A lot of people get confused as to what the VA does. There's 3 different branches of the VA. There's the VBA. Those are the people that maybe when you first got out or when you were buying your first house, you went and got your home loan through. You went and did your compensation and pension exams, got your disability rating, that kind of thing. That is done by the VBA. Okay. The NCA, National Cemetery, basically pretty much says it all. That's what they do. They go out and they maintain all of the cemeteries in the area. I know Fort Logan is expanding. They bought some more property in the Fort Logan area. They also bought some more property. They're going to take over the Cheyenne Cemetery up there. And then if anyone cares, down south, Pikes Peak now has a cemetery, which I guess is really beautiful. And then Fort Lyon, which is really down south out by La Junta, Los Animas area, they're taking over that as well. And then of course the VHA, which is where I work, we do the health. We do, I don't know if many of you know, we do lots of medical research. Some of the cool things that go on, we do a lot of diabetes research, we do cancer research. One of the things that I was just witness to, we had a reporter come in because they wanted to do a story. We have a researcher that in cooperation with CU who is doing a prosthesis, like your hand. If you go to grab something with a prosthesis, you're grabbing it. You're just a proximity thing. You can't feel it, but I got this paper, right? They're working on a thing where they will connect in a nerve and your prosthesis will have feeling. So cool stuff, isn't it? So the VA is working on that. So we do a lot of research. Emergency preparedness. So as you can imagine, we're a little busy right now. We're also part of the state. We're a location where you can bring in patients if needed for national emergencies, like we're going through right now. And we're also a backup to the DoD medical system. So. And just like with the military, like with the Air Force, let's say you have your major command. So our major command is called the VISN. We are VISN 19, so we report up to them. And then they report to Washington. So we have a big area. So not we, but okay.
You refer to yourself when you call it Eastern Colorado.
Eastern Colorado healthcare system.
Yeah,
So this is us.
that's it, okay.
So the light colored, this is 44,000 square miles. So this is what our healthcare system covers. We have clinics throughout the area. For some reason, Los Animas County is covered by Albuquerque, Western Slope, and then Cheyenne. So some of you, if some of your constituents or some of the people in this area may actually go to Longmont or the Loveland Clinic. I think it's a Loveland Clinic. That's all falls under Cheyenne. I know it's weird, we can't cut a line straight for anything. We cover part of Kansas as well. So we have roughly, 385,000 veterans here in Colorado. I'm sure it's not a big surprise. El Paso County is our highest growing veteran population, almost in the nation. I think it's second. So it's pretty intense. So we have 11 clinics and 2 telehealth clinics. So our telehealth clinics are Salida. So they go in and, they basically go in and have their appointments via telehealth through the TV.
But they go to an office or a location in Salida to do
Yeah.
that?
Yeah, there's an actual building you can go and do that.
I just did that. Mm-hmm. And the doctor was in Salt Lake.
Yes.
And I was at the Golden Clinic. Mm-hmm. And I was really apprehensive about it. I thought it worked great. So, the nurse is taking my vitals, and it's right in front of the doctor, and I'm communicating just as good as you and I are.
Right. And your vitals were taken. So when you go to the Salida Clinic, you have a nurse that takes your vitals, and they do that. But you're also talking to a doctor, and some of them are in Salt Lake. A lot of times they are locally here as well. But we partnered with Salt Lake with some of our mental health appointments as well, which is really important for our, these areas here where you have a lot of veterans that, that's where they live. They really don't want to come to the big city, but they still need that type of help. So they can dial in from their house and have a telemental health appointment. So that's actually pretty cool technology, and it's helping. One of our biggest issues in the state is veteran suicides. Colorado is one of the states that leads the nation in suicides, not just veterans, but suicides in general.
Is there any thought why?
They're looking into that. There really isn't. I don't know if it's because of the population growth or if it's something as strange as altitude, That's something they're doing research on. It is a strange statistics because it's considerable.
My daughter was a telehealth nurse for the VA. She just retired. And, she had 150 veterans assigned to her. Mm-hmm. From throughout, I don't know where all.
That's awesome. Oh, great. Thank her for doing that. The last year we had over 1 million outpatient visits and almost 5,000 surgeries. So we see a lot of veterans. And as I mentioned earlier, we do a lot of research. Last year we did $23 million in funded research. We are trying to amp that up and do a lot more partnerships with the universities around here. And like I said, Colorado Springs is our highest growth rate. And we have academic affiliations with the university. So we train doctors at the hospital as well. So I don't know if a lot of you know that, but we do a lot of training. So we have a lot of residents there. And then we have a lot of volunteers, and they put in tons of hours. So last year it was 137,000 hours. So we appreciate everything that all of our volunteers do. We can't run the place without it. And these are the big guys that run the place. Michael Kilmer had just come to us in September from Grand Junction. He's our director, and all the rest of the leadership team.
What are their qualifications? What are they?
So,
MBAs or something?
so Dr. Parmalee, he was the chief of staff at Vanderbilt University. He is also a lawyer, and he was in the Air Force for 4 years. Keith Harmon is our chief nurse. He has the MBA type equivalent to master's in nursing. Dwayne Gill is a Navy veteran, I think 6-year Navy veteran, and he's come to us from the East Coast, basically running some of the smaller facilities there. Josh Pridgen, he is an amazingly strong business sense. He kind of runs the business portion of the hospital. Shannon Newell, she is a West Point grad. She was a Army police, so she's kind of tough. Don't mess with Shannon. And our director, he was in the Coast Guard for 12 years. So we've got some military background there.
Is Dr. Johnson still with you? He used to run the Golden Clinic.
He is not. I believe he moved to out of state.
Oh, he did? Okay.
Yeah.
He's a good guy.
Yeah, he was a good guy. Yeah, still is. I'm just not sure where he's moved to. Yeah, he's still a good guy. I'm just not sure where he's a good guy at. So at the Rocky Mountain Regional, we call it the RMR in Aurora, we have some new services available. Mammography, which was not available. We used to have to send that out. We have a PET scan, which is a way to kind of do some more evaluations inside your body, see what has changed. Our ORs are something from like a sci-fi movie. They're pretty cool. And the other amazing thing is they're all single rooms. At Claremont, because it was built in the 40s, you had to walk down to use the restroom, right? Families couldn't stay in the rooms or anything like that. All of the rooms have windows. They all have a place where a family can stay. They're large, and there's a restroom. So our fall cases are a lot less. That's a big deal. We also have the VBA in our facility, which is great because a lot of people come in, they have questions for the VBA, and we can't answer those all the time. And so on your chairs, I put a flyer. This is all of the outside of the main location that they're in Lakewood, the VBA. So if you have questions in regards to your disability rating or anything like that, or if you have a friend or fellow veteran, these are all the locations that the VBA are located in our hospitals. So they have an office in Colorado Springs as well. So you look at our hospital and you think, oh, you must have tons of beds. Well, we don't have tons of beds. This is the breakout of the beds in our hospital. We have 148 total beds, 28 in ICU, medical surgery 50, rehab 8, inpatient I can never say that word, psychiatry, thank you, and our spinal cord injury unit, which that's new, a really cool thing, and I'll talk about that in a minute. And right now our PTSD unit is at the old hospital in our community living center. They are planning to put it on the Rocky Mountain Regional site, but it hasn't been built yet. Okay. Some of the deals with like surgery we've moved. We have some small procedure rooms. Instead of taking up operating rooms for GI procedures, we now have dedicated rooms for things like that. So we can do more big time surgeries and move that up. Just this February, we opened up an employee, basically a way to do simulation training. I call them robots. I know that's not the word. I'm a business major. They're robots. But they look like people, but they're not. And it's just a way to talk They actually talk, which is a little creepy. But we're learning from it, okay? So it's a way to interact and learn and without causing harm or anything like that. And then in October of last year, we participated in our first homeless stand down in cooperation with the Denver. It was huge. It was at the convention center, and it was very invigorating. I personally watched our homeless service offer houses or offer a place to live for 4 or 5 people, and it was really great to see this actually working and to be part of that. Our Fisher House should be opening here in spring. Does everybody know what a Fisher House is? Or it's basically like the Ronald McDonald House for veterans and military members. So
They're gonna be located on campus?
it is, yeah. It's right at the far north end by employee parking. So usually if you go to the hospital, you don't see it. But
So that's for family members, right?
It's for family members.
When you visit someone who's in the hospital for a period of time.
So for example, we have a gentleman in the SCI unit, and his family member is staying. We have a Fisher House currently on the other side of the CU campus in an old general officer housing. So he is staying there and then comes to the hospital to care for the family member. So that's kind of how it works. You know, you have to actually be in a facility to get that care. If your family members at CU, or, you know, a lot of times that does not constitute the ability to use the Fisher House. And we're also looking for locations. So Colorado Springs is, there's a lot of people in Colorado Springs. So we're looking at, we just got approval to open or look for a space in Castle Rock and open up another small clinic in Aurora. Because the one we have that's not the hospital in Aurora is very small, and eastern area of Colorado is growing as well.
But do those clinics actually have beds
No,
for people?
those are outpatient clinics. So if you go for your primary care appointments and things like that. So for all of you that have friends that are women veterans, we have a really robust women veteran program there. And they go out all the time. It's a very high growing population. And we have 55% of our women veterans are in Colorado Springs. That's not a huge surprise.
And are less than 50 years old.
Yes, and a lot of them, obviously, you know, are childbearing years. So we provide care up to 12 weeks and prenatal care, and then we send them off to the community because we just can't have babies in the hospital right now, or that's just not our focus. So we send them out into the community to have babies, but we do monitor and keep up and make sure they're getting all the adequate care and supplies. So
Is it normally over the Anschutz Center there, just across the parking lot, when they send the women for childbirth?
it kind of just depends on where they pick.
Oh, okay.
Yeah. So how do we communicate? So I'm part of the public affairs team, and so sometimes communication can be really difficult, as you guys probably know, running the museum. I put on your seat like a little card here. We're highly active on social media. So we try and put out information as many ways as we possibly can, because we understand that not everybody jumps on the internet. Not everybody has a Facebook page. So we do letters, like if it's how many of you received a letter in reference to the Mission Act or community care in the mail? Yeah. So we try and keep up by sending letters. If you have an appointment, we'll send you text messages if you opt into that. How many of you are familiar with MyHealthyVet?
What is that?
Okay, so I'm glad you asked. So how many of you are actually enrolled in healthcare at the VA? Okay. Do you have MyHealthyVet? No? Okay.
That's your problem, Dave.
That's it.
Wait, I figured out world peace right
They
here.
found out what I was like, and they moved me out the door.
So MyHealthyVet is a way to communicate with your provider, your team, through a encrypted email. So you can send a message to your doctor. You can find out if you have prescriptions available. There's a lot you can do on MyHealthyVet.
That's like a patient portal then?
It is like a patient portal. Like I've got a Centura Health one, which it's great because I can make sure you can get your lab results, things like that. So if you're not enrolled in it, I suggest enrolling. They can do it for you at the hospital. The point of contact is Larry Wilson, and I can get you that later if you want. And obviously we try and keep up on the internet, keep everyone informed. I do town halls. I go out with leadership or whoever is requested to come out and talk. And then I just, again, relationship with our community partners.
Are you linked up with the VA service officers in various communities and stuff?
Yes, the county service officers, yes. I went to their, this is the third time I went to Broomfield.
Gary's up there.
Oh, here's upstairs.
Yeah, I went to their annual convention last year, which was in Westminster. So yeah. If you ever want to find out how we're doing, we try and be transparent. The information is on the webpage. If you want to know, like, you know, how many doctors we have or how long's the wait time, things like that. There's all kind of information that you can get if if you're shopping. In addition, you can find out what Cheyenne is doing if you prefer to go up that way. So eligibility. So has everybody at least gone and got their disability rating from the VBA? Do you know what that is? No?
I have one.
You have one, okay. And you must have something. You're
I've never done it, actually, a disability rating, I don't know.
okay.
That's where you can end up with nothing, like I did.
Oh, okay.
So you can have a 0% disability rating, but you still can qualify for things.
Well, you can try and cure yourself.
Okay. So a disability rating is basically you go through the VBA and they tell you, they kind of go through your medical records and your service records, and then they give you, let's say, we'll use my husband as an example because he's a hot mess. He has back, he had this, and this, right? So he went to do exams. Basically, they looked at his back. He had like a Humvee issue. And so they gave him a disability rating for his back. They looked at other things and they gave him a disability rating for those various ailments. And they give you a total rating. So you'll get a total percent. And it could anywhere from 0% to 100% disability. Okay? And then with that percentage, that'll tell you kind of on the, if you come to the hospital or you have a doctor's appointment, if you need to do a co-payment or anything like that. VBA also pays disability compensation to you. So if you have a 50% disability rating, there's a dollar amount attached to that, and every month you get a disability check. So if you haven't done it, you could try and get a disability rating.
Can that be started through the VA service officer in the county? Or
Definitely. I highly recommend going through your service officer, your county service officer, or American Legion. A lot of all of those organizations have someone that can help you through that. I discourage you going straight through the web page or straight to the VBA. They're not going to be as diligent on your behalf as your county service officer or someone in the American Legion. So, and then for those that aren't retired military, the commissary is now opened up to veterans if you have a disability rating. So you just have to show them your health insurance card from the VA. It has to say that you're a disabled veteran, and you can get on Buckley or whatever base you need to go to the commissary. So I don't know if that just started in January, so that's kind of a cool deal. I hear they still have toilet paper. Okay. And again, if you have to make co-payments for any sort of care that you go to, it just depends on your disability rating. And some of that is explained in the healthcare options booklet that I left with you guys.
Speaking of that, what I find interesting is I have a $50 copay if I go to the hospital. If I do the outpatient stuff, I don't have any copay.
Oh, that is interesting.
Right, because they've done 4 surgeries on my eyes last year at the hospital. One, I'm talking, they did 2 at the hospital, and they've done 4 outside across the street there at UC Health.
So a lot of times your copay for a specialty visit, maybe audiology and whatnot, those copays can be a little higher.
Yeah, so I
Yeah.
thought it was interesting.
But if you go in for like a primary care appointment, your copay is not as high. But specialty care appointments, those, if you go in for anything like that.
I assumed it had to do with my income. Is that true?
The VA math involved with that is complicated. So it can include your income, it can include your disability rating, it can include several things. Yeah. And if you haven't gone in for your disability rating, you might want to. All right, woo! Pass the hand sanitizer, right? Okay, so.
Should have forgot the Corona part.
Corona what? Did you guys bring limes?
Yeah, see, it's hurt the beer sales.
Oh, so I saw a joke online. It was kind of like, so we're closing everything down, all the holidays for the next month. So no St. Patrick's Day, no Easter, but we'll be open just in time for Cinco de Mayo, sponsored by Corona. Okay, that's all I got. Okay, so we have actually implemented our emergency management team. They've been sitting in a conference room for a week and a half dealing with all this and trying to keep everyone as up to date as possible. So this information is current as of yesterday afternoon. So I can't tell you much more than what's up here. So starting on last Monday, we implemented a program where we do some pre-screening before you even get out of your car. Okay, so at each location where you could park, we have people out there asking you the 3 questions. Have you traveled to blah, 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 blah? Do you have any symptoms of? And I can't remember the 3rd question.
Why are you here?
Yeah, why are you here? So if any of those are yes, then we follow up with more questions, and then if they're showing symptoms, then we actually have them drive around the block to the emergency room. And we walkie-talkie and say, hey, we have so-and-so in this car will be coming in the emergency room. They're showing signs, or they feel like they have signs. So we'll have someone come out in the hazmat suit and test the person in the car. And then same protocol with any hospital is we can do a preliminary, yes, you have it, yes, no, you don't. But it still has to be confirmed by the CDC to be an actual case. And that's taking, I believe, up to 24 hours to get that confirmation. We do have 2 veterans in our system that have confirmed cases. They're all at home, quarantine themselves at their own homes, so they're not in the hospital. That was their choice. So, nothing has come into the facility as of yet. What we're suggesting is, so starting this week, call before if you have an appointment, call. Okay, just to make sure, everything is running smoothly. And like I said, this is updated as of yesterday, so something could have changed, okay?
What
There,
number do you call? I mean, is it just the basic appointment number?
Yeah. yeah, just call the basic appointment number, the 303-399-8020, the main hospital line.
Let's just say I don't necessarily have an appointment to see my, primary doctor for anything, but I think I'm coming down with it. I can go ahead and call that number.
So if you think,
Initiate something.
you could probably just drive to the emergency room.
Oh,
Yeah, that's what I would do. Just drive to the emergency room. And they have the same people in their outside checking and asking those questions. And when you say, I think I have, they'll follow the protocol of have you, park and do the test.
You can do that at any of the clinics, or do you have to go to the?
So right now they're working on some sort of protocol for Golden and Aurora Clinic, just based on the availability of staff.
Right.
But definitely at RMR, you can do that. In Colorado Springs, they have the same, they don't have an emergency room in Colorado Springs, but they can do the testing outside. And if you come back with a pre-positive, meaning before the CDC confirms, then they'll send you to Penrose or one of the other hospitals' emergency rooms under those protocols. So again, all patients and visitors. So if you're bringing if your teenage kid is driving you because you just don't feel like driving, they're going to get pre-screened as well. Pre-screen's just the questions, okay? We request allow a little extra time before your appointments. We've been doing the screening pretty fast, but still allow just in case there's a line. We've kind of asked that you not bring a lot of people with you. We've also asked, unless you need someone to drive you home or whatever, just to eliminate all of people coming unnecessarily to the location. Starting on the 20th, which is next, is that Friday? We are working on converting as many face-to-face appointments to telephone appointments in the primary care. So if you have a primary care appointment, our staff are calling and letting, we'll say, hey, Dave, we know you have an appointment next week. Are you good if we just do a face-to-face or a telephone appointment? And if you're like, well, I'm really got some special needs, I really need to see someone, then they'll work that at a case-by-case basis as to having you come in, okay? Or doing telehealth, okay? So we're trying really hard to be proactive, but not reactive. We're not trying to freak everyone out. We're just trying to be, let's just do this and be cool about it and get it done right. We are restricting visitors to visit patients. So where'd he go? He was just there. So people that come in and volunteer to come in, they talk with the patient and whatnot, we are restricting that access.
No more dogs, huh?
Dogs are fine. Bring your dog. The iguanas and all the comfort parrots, don't bring those. I don't even know what that's about. I have a turtle. I'm going to bring him to work one day. Also, per national guidance, there will be no visitors to we have a community living center or nursing home in Pueblo. Unless it's an end-of-life thing, there are no visitors. It's a nursing home. We've got a lot of delicate patients, and we just don't need that going through the facility. In addition to our SCI, our spinal cord injury unit. So our spinal cord injury patients they're dealing with a lot of stuff as far as, immune problems, in addition to whatever they're in there for as far as spinal cord or any type of prosthetics or prostheses injuries. So we have a no visitor policy in those two locations, just to keep everybody safe.
Is that due because of the court violence?
Yeah. and that's national. So we have no say, even if we were like, well, you know, we'd really like you all to see them. So, and then minor elective procedures, we're suspending those starting the 13th, which is yesterday. Friday the 13th. So.
Does that include getting replacement hearing aids and things like that?
I would think so, but if that's something you might want to call ahead and ask that question. Yeah. Any other coronavirus questions? I don't have a lot of details.
So if someone comes in and shows positive, but you think it's kind of serious, will they be then referred to a local hospital for subsequent treatment? Because you don't have that many beds.
So that's what our incident command team is working on, is being able to do some sort of designation. We have 2 rooms. They're the negative air rooms, where the one veteran that did, so just give you an idea how that worked out. He called and said, I've been traveling, and I think I have. And our doctors, our infectious disease team said, we need you to come to the emergency room, but stay in your car. He did, and we met him in his car, took the test, and you know, you make them as comfortable as possible while they're sitting in their car. We got the pre-test saying yes, so we brought him in, we gowned him up and took him to the negative air room, and you know, they did whatever they were going to do. They deemed at the time, he's like, I'll just self-quarantine at home. And that's kind of how that worked. So that was very optimal. He was very proactive. He was very like, I know what's going on. And he didn't just come in and walk around the facility, which is great, you know, because there's a lot of people that are just like, well, I have this cough. I'm not breathing well. Okay. So, you know, that's how that was handled. Very, very smart individual that came in and did that. No need for toilet paper, just saying. Or bananas and potatoes, those were gone too. I don't even understand.
Water. I'll get water too.
Yeah, bottled water just amazed me.
Yeah.
I don't know.
It worries me, if we ever really have a national emergency, you know.
These people are crazy.
You know, the questions that they're asking, they did the same thing, in my case, Kaiser. They would, you go in and check in for anything, and they'd ask you those 3 or 4 questions if you travel to West Africa for Ebola.
Right.
Back in the day.
Right.
And that kind of just dissipated, so I guess there's still cases of it, but it's not like an emergency. But they were asking all those same questions.
I know if I go to Centura Health, and the first, you know, when you're checking in, they're like, have you traveled out of the country in the last 30 days? And most of the time I have to say, no, I haven't done anything fun. But I think if you said, you know, I was just in South Africa, then they probably have another list of questions to, you know, oh, so did you eat monkey or whatever? So kind of as you guys do, I'm part of, the director put me in charge of the art working group. So if you come to the hospital, you may have noticed that up and down the concourse, there are 5 boards that are absolutely covered in veteran art. We rotate that artwork 3 times a year. Right now, everything that's up is competing in the National Veterans Creative Arts Festival, which is really cool. But it's also, we offer it for sale. And if someone is interested in buying a piece of art, we work the process. We have sold about 25 pieces of art, about $10,000 worth of art. We take no cut. It's 100% goes right back to that artist. So it's kind of a cool deal. We're the first VA to do this, so I've had to answer a lot of questions to other VAs because now they're interested. The other thing that's kind of cool, and as I talked to a couple of you, I'm in charge of the display cases, and this is my grandfather. That's my grandma, and that's his Army Air Corps uniform. I am in charge of the display cases that go up and down the concourse. So I've been adding military memorabilia and historical items to the 10 display cases. So I would be happy to, if I get something that's really cool or I'm out of space, I'd be happy to contact you guys to see, hey, I have someone that just contacted me who has a framed LA Times D-Day newspaper, and I don't know if I can take it. Might be too big because I'm running out of space because I can't put things on the wall.
But we could gladly help you provide some nice stories about different veterans.
And that would be great because I can kind of move some of this stuff out. Like I said, I've kind of just filled this with my grandfather's stuff until I get others.
And you only had one grandfather, right? Anyway, was in the military.
Well, my husband's grandfather was Army Corps of Engineers in Saipan.
Running out of grandfathers.
I'm running out of grandfathers. I don't know. No, my other one didn't. He was a hot medical mess, so he didn't go. So I'd be happy to whatever partnership you guys, and if you want to do a display case and we can promote the museum here, I'd be happy to do that. That would be.
Could you email me a photo of kind of your typical display case to get an idea of the type of space you have?
Definitely.
And, you know, the type of.
And what, about 4 feet wide?
They're about, I want to say they're about 6.
6?
Mm-hmm.
Yeah.
Yeah.
I have one that is kind
Very
of,
long corridor. They're really interesting. You do a nice job. I check them out every time I walk.
thank you. I just got a new set of G.I. Joes. Like, there's like 10 of them from Navy and different eras and stuff, and they're pretty cool. So anyway, happy to partner with that. And then this is the art program. These are just pictures of some of the art that is up. We get lots of people asking questions. If you get anywhere near the art board, they're like if you're taking a piece down, they're like, are you putting new stuff up? I mean, people get excited.
We've got the same thing upstairs in the main corridor there. And we have it's military oriented, of course.
Yeah,
We've got some stuff up there now. One of the ladies that did it is in the Air Force.
that's awesome. I saw some of them.
Yeah.
We're kind of, some of the stuff is limited. Like we can't do like religious, being government, we kind of have to limit that. Can't do weapons. Like my display cases, I had a Marine sword, couldn't put it in there. So we're kind of limited a little bit on those rules and regulations. So anyway, and that's what I've got. If I have, no, probably not. Just to also let you know, so another thing I left on your chair is a map. And I know Mike did a good map. What this map is kind of a way to self-tour the facility down the concourse and give you an idea of what's going on. So each area that's annotated here, you'll see like little notes about it. So if you ever get to the hospital or you want to see, kind of see what you're looking at, this will help. It is not online because it's always updated.
Where's the regular hospital? The hospital base?
So they are in K and H.
Oh, okay.
Actually, yes. And you'll notice, so when you see this map, I'll tell you something kind of cool that might not be on the. No, it's not on the description. So between H and F, do you see that little line here? There's a little line. On the 3rd floor is where surgery is in F. And when a patient comes out of surgery, they go into inpatient, their inpatient room. There's a bridge, and that's what that is. That line is the bridge. So we can get the patient from surgery to his inpatient room without, I don't know if any of you had surgery, but you're carted through the hall, you're like waving to people, and you're like, this is totally private, so you're just coming through. And the other amazing thing is if there is a complication, they can get you back into surgery and it's fast, because they're connected with that bridge. So when you're there and you kind of look up and you see a bridge, that's what that bridge is.
How close are you to capacity? You always hear about, sometimes big delays between when you can get in to see your, doctor or things like that.
So a capacity as far as seeing a primary care doctor, things like that. So you can go online and look at our wait time. So a primary care doctor, I believe currently we're at about 8 or 9 days, which I know if I go to see my TRICARE doctor, it's 2 weeks. Mental health at, I think is like 3 days, which I know if you're in a crisis, and there are phone numbers for that too, but if you're in a crisis, you can utilize that. 3 to 4 days can be kind of long. We're not bad. And with Mission Act, which I don't know if you're familiar with Mission Act. Mission Act is basically community care. It was enacted by Congress June of last year. And it enables veterans to be able to use the community if the wait time is too long. So let's say you need to go get your knee replaced, and orthopedics can't get you in for like 3 or 4 months. You can opt to ask for community care. Now that doesn't mean someone out in community care can do it faster, because our community is still having the same issues the VA is we're just short medical providers. It's hard to get a doctor. So a lot of those wait times are being cut down because we can send people out. But we're also trying to open up some more clinics to help alleviate that too.
I've done that on the eye care. They did 4 surgeries on my eyes at UC Health, all for the VA. So that really worked well.
Good.
Yeah, really did. So.
Any other questions? Yeah.
Well, just one thing. We have Tim Hutchinson coming back in 13 June to give kind of his quarterly update. And I was wondering if I could get you to maybe come and join him and just give a further update of anything we want to talk about.
I think that would be, I'd have to check my calendar, but yeah, definitely.
I'll send you an email about that, but I think it'd be a great combination of both of you.
Yeah, that's not a problem. Yeah.
When are you going to Africa?
Well, I'm supposed to be going to Africa on April 17th.
Oh, okay. So
We'll forget that. You're not gonna get back.
That's okay. Just get me there. I don't care.
I don't know if anybody I was gone for a little bit, so, but there is, you mentioned the VA research that's conducted at the VA hospital. And are you familiar with the Hyperbaric Chamber in Louisville that treats traumatic brain injury and PTSD for combat veterans?
Is that through STERM?
It's actually, they're their own entity. They're a
Okay.
501c3, and it's oxygen under pressure.
Right.
And I've worked, I should say, with the American Legion and the Hyperbaric Chamber up there for the last several years. And almost every veteran, every veteran that I've talked to that have been through that program have really appreciated and felt that it really helped them.
Okay.
And I just wondered, because it's not covered by the VA.
Right.
And but it just so happens they are a 501c3. It's all free for a veteran. They have a place for the person to stay for a month while they go through for free.
Right.
They even get they get a card for food while they're there.
Oh,
It's
nice.
really a nice deal. But anyway, there has been talk, I thought, about the VA or possibly the military conducting research on hyperbaric chamber under oxygen, and to see if that would help TBI and post-traumatic stress.
Yeah.
And I just wondered if you've heard VA doing anything like that?
I haven't, but we have so many research programs. I mean, I can find out. It definitely would be interesting to know.
Okay. And then I thought somebody said that there would be down in San Antonio, either the Army or the Air Force, were doing some research, but I haven't heard anything about it. So
The research people, so if you look at this map, research is in Building B. It's shaded out. It's kind of like the golf balls. You're not supposed to know they're there. They do so much stuff, and it would be great for some of us that have to, we go out and we talk to people to let them know. These are some of the things we are working on. So, yeah, I'll have to find out.
yeah, I'll ask some questions about that. 'Cause, like I said, I've talked to these veterans that come through Marine, Army, Air Force, Navy, and they all just think it's a wonderful thing, and they see a lot of benefits from it. So.
Yeah, that would be great. Yeah, I have heard about the hyperbaric treatment, and I know our mental health team they're doing a lot to expand their services. So I'm not sure if it would be within research or if mental health is already we're trying to figure something out. Yeah.
Are they increasing the mental health aspect a lot more because of all the suicides than they used to, or?
They are, yes. And some of the guys that I do outreach with are on the there's a governor's challenge. I don't know if you guys are familiar with that. So certain states are part of the governor's challenge. Colorado is one of those, where we are trying to eliminate as best we can the whole veteran and suicide issue that's going on. They go out into the community. I get them signed up for all kinds of speaking opportunities to talk to groups like you guys, just to kind of give you an idea, not basically to talk to you about not committing suicide, but to talk to you about the signs and what to look for, whether it is a fellow veteran or if it is a teenager, because there's a lot of teens that have a lot of issues, or just population of 55 plus males is the big population, and they're having that problem. So we're out there. We're trying to kind of think outside the box and training the Postal Service. So a lot of veterans are out there off their grid. They don't want to be found, but guess who always finds them? The mail. And so if a postal worker sees that maybe the mail's piling up, or that no one shoveled snow in a long time, that's kind of some indicators. So we're trying to think outside the box to see what we can do to maybe curtail this a little bit.
If any of those other outreach groups are looking for a place to come to talk, we gladly would host them.
Okay, I know that they it's called SAVE training, and we've done it at various town halls, the American Legion conference.
We're connected with the American Legion right here.
Yeah, my post 58 meets here.
His office is
once a
right
month.
next door.
Yeah, the office is right across the other side of that wall.
Yeah, there's a VFW group in
VFW.
Brookfield too, so we could kind of
Yeah.
advertise between all of them.
Yeah, matter of
Yeah.
fact, Tim Hutchinson, by the way, is a past commander of the
Right.
VFW here too. So.
Yeah, I think they came out. I was with them last year at the American Legion convention down in Colorado Springs,
Oh yeah.
and then they spoke down there.
Yeah. At the Hotel
Elegante.
Not the Broadmoor?
That would be elegante.
Elegante.
Not so much.
Yeah, Katie, and I've washed it all. So
Oh.
it's pretty clean.
Well,
But anyway,
thank you.
so much.
That's
It's one of our
pretty
challenge clients.
Well, thank you.
Yeah.
Do we fish that
Yes,
one?
yeah,
I'll Khristie.
But thank you so much.
Well, I
And-
appreciate your
and
time
It really was
and-
interesting, and yeah, I'd love to get you back on the 13th.
Okay.
And I'll send you a little message about that.
Okay,
and see what
fantastic.
works. By then, we'd have a lot more attendees, I hope.
I hope this thing is done.
Yeah,
I,
yes.
hopefully I'll be back from Africa by
Yes,
then.
Yeah.
So where are you going in Africa?
We are going to go down to Johannesburg and take like a quick flight and do a week-long safari. And then fly up to Zimbabwe, Zambia to do Victoria Falls for a week. My husband wanted to do Kilimanjaro. I said nope. And so we went. So we're going to the Seychelles for a week. So yeah, I hope so.
Are they telling you anything about how to get back?
He's fixated on you're not coming back.
Because they're saying everywhere but UK.
Well, it's-
US citizens can come back.
US citizens.
Yeah.
So I've noticed the map. Africa is pretty clean right now.
Yeah.
Yeah, I noticed.
Yeah.
Well, they haven't tested anything.
Well, that's true too.
Well, there is
We're
that.
pretty clean.